Whatever you think is best.
Yeah. Well, you're new here. Couple weeks, I guess.
Yes.
Yeah. And Nurse Isabelle, why don't you tell us why you got into like nursing, but more specifically like the holistic aesthetics, natural beauty, that sort of thing.
Right. So I got into nursing because I genuinely love caring for people and making a positive impact in someone's day, whether that was bedside care or whether that was the beauty industry.
Mm-hmm.
I decided I wanted to go into the beauty industry because I always had a passion for beauty, like whether it was makeup. It started makeup in high school. And then it was kind of just like giving people compliments and realizing, oh, that kind of made their confidence go up. Then I kind of got the wheels steering, and I was like, oh, maybe I can do something with nursing and beauty.
Yeah, when the compliments weren't enough.
Yeah, when the compliments weren't enough, when they had something that was
That's less of a compliment. No, it's like, I can fix you.
Yeah, like
You're being quite literal. I was making a joke of it, but...
No, I'm being quite literal.
Are you critical of people? Would you walk, like if you're walking through the mall, you'd be like, that person needs filler. That person needs microneedling.
I wasn't. Now I am.
Now you do.
Now I am. Because my eye is kind of trained to that aesthetic side. So I can see quickly what I would recommend for someone.
That's such a good... It sounds terrible. But it's perfect. Because that's what you actually want. Like, your clients, they want to know, like, just tell me what I need. Because I feel like it's not happening. It's not what I'm looking for. Right. Or I've gone through this or that. How do I fix it?
Right.
As opposed to being like, no, you're fine. And it's like, well, I don't feel fine. But you can actually tell them. So this compliment thing now just went to like, I'm going to fix you. And then you're going to be like, so is that the feedback you get after you do a treatment? It's like, this is what I was hoping for.
Yes. So I like to do a thorough consultation to kind of really understand what their goal is. Mm-hmm. And then that aftermath all depends on me understanding their goal, because I need to be able to understand what they want in order for me to actually provide that for them, mm-hmm. which sometimes it isn't possible. And that's the reality of it.
Could you like give an example of like something, you don't have to out anybody, but I mean, if someone's like, I want you to just pull everything up, like what would be something that's like, I don't do that. Honestly, or you don't need that.
Yeah, that's a common scenario. Mm-hmm. Like that happens a lot more often than people think. Mm-hmm. People have this thought that filler can do that and kind of give them a mini facelift, which in reality, it can lift to an extent, but it's not going to pull all their skin back if they have that loose skin. Mm-hmm. So in that scenario, you would tell them, like, the gold standard is surgery. I won't be able to get you exactly where you want to be today, but I can improve it.
Okay.
Yeah.
Okay. That's honest.
Yeah. I like to be very
it's
honest.
Realistic, because, I mean, this is like an in-office treatment, and obviously short of doing surgery, you're able to do like pretty amazing things. Like, what are some of the services that you do that you find like, this was a game changer, this really made that person's day?
I find neuromodulators, so Botox and Dysport, those are a waiting game, so it takes 2 weeks to see full results, but I find that most patients are surprised with the results, especially the first time after they do it. Mm-hmm. They're not really expecting much, but it can really refresh someone's appearance.
Okay. In what way? Like, what would be like a sign on their face that's like, oh, you need this, and then like what would be the expected result?
So if someone starts to have fine lines, mm-hmm. I normally recommend it because we want to prevent those lines from getting deeper and getting etched into our skin to form deep wrinkles. So that's something that would kind of point me towards that direction. And then, of course, as you keep up with the treatments, mm-hmm. then it minimizes those lines and their skin is a little bit more smoother than it used to be and there's less movement. So
you're identifying like it has a preventative, like it's not going to allow like a crease here from like becoming like this divide in the forehead.
Especially if you start before any lines are formed, that's extremely preventative, and that gives you the best bet of preventing those deeper wrinkles.
Yeah, I didn't realize that I mean, I'm just familiar with the effect, but not that it's actually reducing the risk of you like developing those like pretty much permanent, frown lines or wherever the lines are showing up. So I guess it's addressing like collagen or the substrate, whatever. It's not letting it like crack or whatever it is.
Yeah. So somewhat. So what it does is it goes into the muscle and it kind of relaxes that muscle. And when you make like a surprised face, when you raise your eyebrows or when you frown, that muscle is so relaxed that it's not going to pull the skin with it when you're making that movement.
Is it completely paralyzed?
No, I wouldn't say it's paralyzed. Okay. Just the movements reduced.
No,
don't worry.
It's a taboo word to say.
I know, I wouldn't say that. People do like less movement. People like more movement. It's very customizable. It's not a set dose per patient. It's so much like to their anatomy. So, yeah.
That's really cool.
Yeah.
Okay. What other services do you find as like, this is something that really makes a difference for people because like this X, Y, or Z? Explain that.
Microneedling and PRP.
Okay.
That's my personal favorite as well.
Oh, okay. Yeah. We'll break it down. Which one do you want? You want to talk about microneedling, or do you like them? They're paired.
Yes,
okay. Yeah.
Paired. I love it paired. You can do it separately. Microneedling's great on its own as well, but paired really gives that enhanced effect. So it's microneedling results paired with PRP, which is rich in growth and healing factors. That's just like your results are enhanced.
Yeah. So pretty much at the session, you'll draw their blood, centrifuge it, and then you pull out the plasma.
Yes.
And then you're applying the plasma while you're microneedling.
Yes.
Okay.
Yeah.
And like what sort of conditions benefit from that?
I would say acne scarring benefits from even microneedling on its own. Things like dull skin or textured skin, hyperpigmentation, fine lines even.
Sure.
Just anyone looking to refresh their skin or anyone that's losing collagen, which we all start to after 25.
Okay.
It's great to start repairing that collagen and stimulating it to build more because it's inevitable to age. So that's a great preventative way.
So regarding collagen, like, do you ever recommend or encourage people to use like a collagen supplement for their like, in addition to what you're providing? They
can. I mean, I don't know too much about supplements regarding collagen.
Okay, I'll explain.
Okay, yeah, you do this.
No, but I think, to be honest, like to be like very comprehensive, like doing your procedures, they have such a huge impact. But I feel like even if it's like for a younger person that's already showing early signs of aging, they probably need something like nutritional just to add to what their body might be lacking. And maybe that's part of the reason why they're showing early signs of aging.
Of course, yes.
So that might be, and I think generally speaking, people are lacking protein across the board. Collagen is, a component of that. So yeah, I would say like if you're doing microneedling and PRP, I mean, there's also something to be said about the plasma, the blood itself, and, making sure that, you're healthy. So,
exactly.
So working with a naturopath who works with a nurse,
there you go.
It's a good combination. How about PRP for anything else? What other aspects of PRP treatment do you provide?
I don't provide any other as of now, other than skin and hair.
Okay, well, that's what I was looking with the hair.
For the hair, yes. Yeah. So it's great for hair restoration as well. I've noticed pretty good results with it, but it depends on their blood, of course. So if they have an underlying condition or if they have, for example, low iron that's inhibiting their hair from growing, that has to be fixed or supplemented first before we go into the PRP.
Okay.
Because it's kind of like it's just going to fall through the bucket and it's not really going to do much.
Okay.
Yeah.
Okay. I mean, I don't want to segue too quickly, but I mean, you also are providing vitamin infusions.
Yes.
So I was wondering if would vitamin infusion, like doing a Myers cocktail, maybe help promote some of that, the plasma and the blood richness?
Yeah, so if they are low in any of the vitamins or electrolytes or any IV bag I really provide, if they're low in any component of that and we infuse that, that'll definitely help. It is recommended to do blood work, of course, to check their levels, maintain it. But yeah, that's definitely a really good option.
Okay.
Yeah.
Well, I mean, I already did the transition to the vitamin infusion conversation. I mean, before we really get into it, was there anything else in the aesthetics that like you wanted to highlight as like things that you really feel like, you know, I want people to understand what this is about?
Yeah, so maybe filler, because there's a lot of stigma around filler.
Yes.
Especially people that are coming in, they're like, I don't want to look puffy. I don't want to look like a pillow face. I feel like good filler is hard to notice. So those people that come in saying that they don't want to look puffy, I completely understand, because we're so exposed to bad filler, and it does make people look puffy. It does make people look like a pillow face, but strategically placed, I feel like filler is great for aging, because as we age, our bone resorbs and our facial fat pads start to fall. So right now we're an inverted triangle, and we become a triangle as we age.
Yeah.
So it's more fullness in the lower face. So to help prevent that, I recommend filler to everyone, and I hope people are more open to it.
So I guess my question is, what's filler made of?
Hyaluronic acid.
Okay, is that like naturally occurring?
Not so much.
Okay.
It's cross-linked hyaluronic acid.
I see.
Of course, it absorbs water and attracts water because it is hyaluronic acid. So that's kind of what makes the fullness occur in our faces,
Sure.
which is also why we might be swollen for the first 2 to 4 weeks after filler.
I see.
But as it settles, it looks beautiful if it's done right.
Okay, and where do you usually, like, is it like temporal or?
Yeah, so we can do temples, we can do cheeks, we can do the piriform, which is right beside our nose, chin, lips, jawline. Those are like the main areas.
So it's kind of like reinforcement.
Yes, it's more structural.
Yeah.
Yeah.
Okay, that's cool. And like, so what happens? Like, is it like permanent?
Filler, it's not permanent, no, but it can last a lot longer than people think.
Okay.
Normally, 6 to 12 months is around the average time that it can last, but it can last up to a few years.
So what happens? Like, does it just disappear?
It metabolizes over time.
Oh, okay.
Yeah, our body just metabolizes it. Some people hold on to it longer than others.
It's not like you have to like remove it.
You can. If you don't like it, you can dissolve it. That's why it's not like permanent in that sense.
I see.
But yeah, you don't have to remove it. It'll just metabolize on its own over time.
Okay.
Yeah.
Yeah. There's a very big learning curve for me, like understanding like the different things. I mean, I'm familiar with, like, you mentioned Botox. How is that different than the dye sport?
Yes. So it's different by how the molecular weight of the molecule, I know that's like very scientific, but it's different in that sense. It's different in the spread. So Botox tends to be a smaller spread than Dysport. Dysport spreads a little bit wider.
Is there a benefit of one versus the other?
Dysport kicks in a little bit faster, so it can maybe last a little bit longer. Everyone's different, of course, but benefit-wise, I would say Dysport's better for a larger area, whereas Botox is better for more precise placement and medical concerns. So, for example, hyperhidrosis, which is excessive sweating in the underarms, I would prefer Botox for that treatment.
Okay.
Yeah.
That's cool. Vitamin IVs, vitamin infusions, vitamin intramuscular injections. What's your favorite? What are the ones that you like to offer, and like the conditions or situations where they're useful?
My favorite would be glutathione.
Okay.
Injection and IV. I love it because it is like a full body detox in a way. It supports the liver detox pathways, and it's a powerful antioxidant, which we already have in our body. So by infusing it or by injecting it, it helps our body fight off oxidative stress. I like to think of it as like a fire inside of our body, and then glutathione's the fire extinguisher.
Sure.
So it's great in that sense. It also has anti-inflammatory benefits. So I find even people with arthritis who have swelling in their hands, I find that after a few infusions or a few injections, it actually goes down significantly.
That's amazing.
From what I've seen. Yeah, so it has great benefits. Yeah, I would say that's
really cool.
Yeah.
Is there, like, when would you use an injection as opposed to an intravenous?
Intravenous is more of a rapid onset. So someone looking for a quick result or a higher dose of something quicker.
So you get more in a bag, like an intravenous, than an injection?
Yes.
Okay.
Injection-wise, I would recommend injections for people looking for long-term results, which most people are. Like, a lot of people do want to maintain those results once they start to see them. And it is a slower release. It is less of a dose, but it is more frequent, and it's more of a sustained release.
Okay.
Yeah.
That's cool. Like what? So you mentioned arthritis would be a good example. Like maybe someone who's like got over an illness or someone that got injured, maybe they would benefit from that?
Yeah, they can. They can. Anything with inflammation, really. Even the skin. So it does have skin brightening benefits.
Okay, yeah.
When I did it on my skin, because I have a little bit of inflammation on my forehead, I found it calmed down quite a bit.
Okay.
So even like skin concerns, it can help.
That's cool.
Yeah.
Okay. Myers cocktail. Everyone talks about it. When do you find it useful? What does it do for people?
So it's great at providing energy. It's great at providing an immunity boost. Great just for overall wellness and hydration.
Yeah.
I would find it's most beneficial, honestly, for maintenance. Maybe an athlete who just wants to maintain their hydration, or someone who works a lot and needs a little bit of an energy boost. I would say that's great. Maybe someone who's feeling under the weather, just to replenish their vitamins and give them a little bit of a kick. I would say Myers is great for that.
Okay.
Yeah.
How about NAD?
NAD is great. It's a buzzword right now.
Yeah.
So it's very...
That's why I said it.
Yes. NAD is great for, I would say, more of an energy boost.
Yeah, okay.
Anti-aging, it can benefit, and just like cellular repair, I would say, because NAD really is a coenzyme. It's found in all of our cells, and it helps convert our food into energy.
Okay.
Yeah. So when we inject it, or when we do an IV drip of that, when we get older, our NAD levels decline. So as we get older, that's kind of where the anti-aging part comes in. It just helps our cells convert that food into energy quicker. Maybe when we used to convert it younger, maybe at that speed. And it just gives great energy production and recovery overall.
Okay. That's really good.
Yeah.
What are, just kind of like reviewing the whole conversation, what are some habits that people do that are terrible for their appearance? That, it speeds up their aging and, I don't know. Tell me. What do you think? Tanning?
Yeah.
Okay.
That hurts me to say because I used to love to tan.
Okay.
Yeah. So tanning, definitely. People underestimate the sun. People underestimate the use of sunscreen, especially in the winter.
Okay.
Yeah. The sun speeds up aging significantly.
Okay.
Yeah. I would say that. I would say smoking.
I knew you were going to say that.
Yeah.
Yeah.
Smoking speeds up aging.
Is it just like the smoke, or is it like, the lines that you get from the...
Both.
Yeah, all of it.
It's both. Even like drinking from a straw can give us those lines. It's not as bad as smoking. Yeah, it's not as bad.
I'm sure.
Still can give us those lines. Honestly, our everyday movements can give us those lines.
So I just walk around like this.
Just walk around, relax.
What other things do people like? What is there anything that they eat? Is there things that they shouldn't have, or is there things that are good? I don't know.
Artificial sugar is a big one.
Yeah.
In aging, even in inflammation, like artificial sugar is just so bad for us, and especially in large amounts, it just causes breakouts. It can cause dullness in the skin.
Okay.
Texture.
Yeah.
It's not good for our gut. It's not really good for us.
How about red light?
Red light's amazing.
Okay, that's good.
Yeah, red light's amazing.
Because I've been hitting everyone with red light.
No, that's amazing.
All our rooms are glowing with red light.
Yes, that's great, especially for inflammation.
How about those red light masks?
It has to be a good one.
Okay.
And the good ones are very expensive.
Okay.
So people usually prefer just to come in for a red light session. Yeah, if they have a bare bulb, that's a true red light bulb, that's great. It's like the Kala brand. I'm not sure if you know.
Yeah.
But other ones are just a scam.
Yeah.
Yeah.
Okay.
Yeah.
Dang, just scam.
Most of
When
them.
you're getting paid by Kala. Okay, so I mean, a little bit of aside from the services is like, you're working with like different types of people and different practitioners. Like, when did you start to understand more about like the natural side of things? Like, I mean, did you always have that kind of natural slant to things because you're a nurse by trade, but you did kind of steer towards more of the holistic beauty. Where is it just that like your education, what you realized on your own personal experience?
Yeah, I would say throughout the training, I did a great training with Seamless Health, and they were very comprehensive of all the different treatments, which some of them were regenerative aesthetics, like the PRP. I just found that I feel like people lean towards the more natural approaches and the more regenerative aesthetics. And also I find really great results when we do things naturally from our own bodies, or just a natural approach over always going to filler and neuromodulators. I feel like it's great in conjunction. So they're great paired together. Yeah.
Okay. Well, that's good.
Yeah.
That's cool. What would you say is like a parting shot or a thought that you can leave people with in terms of like their overall health, beauty? Like, what can they do? What should they be considering?
I would say consider preventative care.
Yeah.
Consider a holistic approach. So as much as your looks matter, so does inside your body and what's going on there, because that plays a role as well into how we look. I would just say take care of yourself, because self-care is so important, and a lot of people overlook it and feel like it's not needed, or it's not as important, or maybe they're guilty spending money on themselves. But it's a great investment, and confidence is your best look.